This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week on the program, a patient's story. We'll hear from Christina Ingersoll. More than a decade ago, she was in her late 20s, living in California, and she underwent a partial hysterectomy. Immediately after the procedure, she knew something had gone wrong.
I woke up and I went to move the gown I was in, and my right arm, my hand felt my leg. However, a portion of my leg no longer felt my hand. And it was one of the first things I said when I woke up was, I can't feel my leg. And they were just like, oh, you'll be okay, it'll be okay. And it has not been okay.
This is the story of Christina's gradual recovery from an injury she thought she would be stuck with for the rest of her life. It's a story about the medical professionals who helped her and about Christina's hard work and determination. In the first segment, I'll share an interview I recorded with Christina last November. She had just finished her first visit with Dr. Thien Ngo, a physiatrist at KRMC. At this point, let's pause to define physiatry.
You know, I was kind of like, what is physiatry? It's not psychiatry. Everybody thinks it's psychiatry. And I looked it up and I was like, oh, that's what that is. Okay.
The whole title is Physical Medicine and Rehabilitation. We mainly deal with functional outcome, how to help patients from a functional loss, diagnosing them, treating them, and help them to improve, decrease the pain and functional loss, and improve the quality of life and how much they can do, basically their function.
We'll hear more from Dr. Ngo later in the program. But first, here's that conversation I recorded with Christina last November.
They had the doctor come in and talk to me, and they were looking at my leg, and they said that they didn't see anything that would be causing that. And of course you don't see anything that's going to cause it. I just had a surgery. It's not like I was outside and fell. So they kind of brushed it off, and I went to my primary doctor, and my primary doctor told me maybe it was a severed nerve. So I went back to that doctor that had done my surgery, and I waited. And when I went back in, he told me that I signed a release when I was at the hospital stating that whatever occurred during surgery, I didn't have any recourse. And it was more like I didn't want recourse. I wanted answers. I want to know why my leg is numb, and I want to know what we can do about it. And he was just flat about it. And my primary kept referring me back to gynecology, and because it happened there. And
Let me interrupt for a minute, if I may. Did you look into any sort of civil recourse?
I did.
Yeah.
And he was correct. I had signed a release prior to my hysterectomy stating that there could be things that had gone wrong, and that I realized liability of the hospital and the doctor.
This happened in your 20s.
27 years old.
And what was it like after that, living with that?
It was hard. That 2 years before I went to Oregon, I gained quite a bit of weight, actually. And I started walking differently. And I couldn't quite explain it. Like, everybody I kept talking to about it didn't understand. I kept telling them, like, I changed the way I'm walking. And because of that, my muscles are hurting, like they're spasming. So the first probably 6 months, I was in constant spasm in my lower back and in my thigh. And I didn't understand. Like, I kept trying to stretch it out, and but anytime I went to do something, it was worse. And I used to do kickboxing. I couldn't do that anymore. Anytime I hit a certain point on my leg, like balancing on my foot, I would my body wanted to just go down. Like, the muscles weren't reacting. Like, they didn't do what they were supposed to do anymore. Yeah. So it was rough. I went through a lot of different changes that I didn't expect in my 20s. I had no idea that something that minor, according to everybody prior, right, could have such a major effect on my mobility. And I kept it going, though. Like, I just learned to walk different and walked through the pain. I didn't take pain meds. I took muscle relaxers rarely. So I just lived with it.
You had numbness in your upper right leg?
Yes, upper right leg from my knee right here to here. It's a thin strip, like knee to thigh, that's just numb.
So that's the numbness. What was the pain from? Was it because your gait had changed?
It was the muscles, my gait. It was just they weren't used to moving in that way, and because some muscles weren't working anymore and other muscles were compensating.
And working twice as hard, sort of, yeah.
It caused a lot of issues to the point where it just kept crawling up to, my mid-back, upper back, neck. So now it's really tight all the way down my back, mainly, though, on that right side.
Yeah. When we first met, I had the gall to ask you a question that might be a bit of an impropriety, but I think I have your blessing.
Okay.
And then, did this also affect your sexual health?
Absolutely. I had the hysterectomy due to endometriosis. There was a lot of scar tissue lining. It hurt very bad when I would have intercourse with my husband. And after the hysterectomy, the weight gain, the depression, and pain, and just not moving the same, it all affected it. It affected it long term, actually. We've adjusted. We're married. We've been married for 13 years, so we've just learned to go about things differently in that manner, but it is not the same, no.
Yeah. And everywhere you went, you the answer you got was, this is the deal. Right?
It was a severed nerve during surgery, and there's not much they can do about it, is what I was told. I just didn't think it was going to happen. And then I heard about physiatry, how they can test nerves, how they can trace things, and how I may be able to get answers.
I want to talk about all that, but if we could, I want to just talk for a moment about the toll that took on you. You said the weight gain, but you also kind of touched on depression. Can you tell me a little bit about that? Is that okay?
Yeah. So when I first started mentioning that I was depressed, they wanted to put me on a bunch of mood stabilizers, things of that nature. And again, I refused because I don't take a lot of medication. I'm not against it. I react differently to a lot of meds. It's not good. So I'm afraid. I don't take it a lot. And I refused the meds. And then they told me that it was probably because of the hormonal imbalance that I had due to my uterus being gone. That it may not be as severe as other women, like I wasn't going through a complete menopause, but because I still have my ovaries, but I may be experiencing, some things along that line. And I knew I was depressed for other reasons. Like I knew that it wasn't, if that was it, that may have been just a small part of it. That when you look at yourself in the mirror and your face literally looks different, it's hard to want to go do things. It's hard to want to get up. It's hard to believe your husband when he's like, oh yeah, we're still good. You're like, yeah, no, we're not, because I'm not good anymore. So a lot of that played into it. And even with my children, they were young when that happened to me. So not having the same abilities with them, not being able to run after my, 4-year-old at full speed, having to kind of gauge myself first, that kind of took a little bit out of me. It was just like, this shouldn't be how it is. It shouldn't be like that.
And you said you had a background as a kickboxer. Obviously, you were very fit.
I was. I show you pictures and you'd be like, no way.
Really?
Yes.
Yeah.
Well, I have photographic proof. And I held on to those all those years. And it was really, really hard for me to go through. It's still hard for me. I'm more excited now. I've lost 60 pounds. So I see my face again. This is how it used to look. So I'm like, okay, I got that back. And I'm going to keep pushing. But
that was the first impression I got of you when we were chatting. I was like, oh, you're tough. You're a fighter.
Yeah, I try.
Yeah.
But this took me out.
Yeah.
The depression was probably the worst part of it because I didn't feel like anybody believed me. Like, I'm not crazy. My leg's numb. And I'd show doctors, I'd make myself get goosebumps and I'd be like, see? And that whole section wouldn't get goosebumps. So they knew like something was going on, but I don't think any of them really understood how much it was affecting my quality of life and my body.
The way that it's affecting your entire health and your mental health.
Right.
And that brings us to Kingman. You've been working at the hospital. Mm-hmm. And at some point, how is it that you became aware of Dr. Ngo and what he does?
Well, I was talking with people actually when I worked in our emergency room, and they had been referring out to physiatry, and then I applied for therapy services, and I met Dr. Ngo, and I saw what people were coming in for, and a lot of what they were coming in for is exactly, almost to the T, what I had been experiencing. So I was like, okay, pondered it. I've been working with the department over a year, and finally was like, I'm going to do it.
Yeah.
I'm going to just go for it. I mean, the worst that they can tell me is that it's a severed nerve. There's nothing that they can do to go about my way.
Which you've heard once or twice before.
Exactly.
Right.
And that's not what I was told this time.
So at this point, you've had one appointment with Dr. Ngo.
Yeah, just a lower EMG, which is a nerve conduction study.
And tell me about that.
He did the nerve conduction study and let me know that it's not a severed nerve. It's a positional injury.
Okay.
That's probably what caused it, actually, was a positional injury. During surgery, the way that they positioned me during surgery caused an ilioband syndrome, like the ilioband in my leg to be damaged, I guess.
Okay.
And it's actually just the few times I've been in physical therapy, what they're having me do, I'm feeling muscles that I haven't felt in a minute. I'm elated, very happy that I'm getting results. However, it makes me really sad, part of me, that this could have been happening a long time ago.
You lived with this for 10 years.
All right, if people only knew. If I knew about a physiatrist, I would have pushed for this years ago.
If you're just joining us, this is Focus on Your Health. I'm T.G. Lafredo, and this week on the program, we're speaking with Christina Ingersoll. She's a patient of Dr. Thien Ngo. He's a physiatrist, a doctor of physical medicine and rehabilitation at Kingman Regional Medical Center. More than a decade ago, Christina was in her late 20s, living in California, and she underwent a partial hysterectomy. Immediately after the procedure, she began experiencing numbness in her upper right leg. According to the doctors she spoke with at the time, as a result of the surgery, she had a severed nerve and there was no way to repair it. The injury changed her life. It affected her ability to walk, which caused her to gain weight, which in turn led to depression. At the end of 2023, Christina became a patient of Dr. Thien Ngo. He performed a nerve conduction study for Christina. In part one of the program, we heard a conversation I recorded with Christina in November of last year. Here is my recent conversation from April 2024 with Christina and Dr. Ngo. Christina, when we first talked, you had had your initial visit with Dr. Ngo and you did a nerve conduction study and you found out that the nerve wasn't severed after all, right?
Yes.
Contrary to what you had heard?
Contrary to my beliefs, yes.
Mm-hmm. And it was a positional injury. So tell me a little bit about the treatment that followed.
So I have started physical therapy. I've done quite a few visits and I've regained a little bit of feeling in my leg. My balance is much better. We're still working on foot strike on my left leg. When I go to run, it's wonky, which I knew. I've known for a while that my gait was impaired. But it's nice to see that they see it and that I'm not, again, crazy. And that these things are really actually taking place, but there's things that can be done, and they are seriously helping me with that. I feel really good after therapy. I feel like I've worked muscles that I forgot or my body forgot that it could use. And then hopefully I'll be more able to move the way that I used to. But I'm already like 70% there. I can feel my body coming back. I can feel a lot, and it's helped with the depression.
Yeah.
I've lost more weight as well, so I haven't stopped that journey, and I've been just hitting it hard, just trying to improve how I feel, not just inside, but outside, like how I'm working, how I'm putting myself back together, I guess you would say. Like, it's hard, but it's doable.
So, Dr. Ngo, you performed that battery of tests. What did you find with Christina?
So on the test result I have for her, I didn't see any major nerve damage as far as the peripheral polyneuropathy. Usually it's just a slowing Poly is many, neuro is nerve, path is disease of a nerve. I try to simplify things for myself. And peripheral is mean just throughout. So what we're looking for is there can be several conditions, including like diabetes, thyroid, chemo, vitamin deficiency. Not that Christina has any of them, but that's usually some of the common differential diagnosis running across your head. And so those are systemic, and now it's a local. Do you have any trauma or injury? So when Christina told me, and I took her past history, and she think it might be interplay. So I test. The first thing I found is there's some slowing across with the nerve coming down, and usually with weight gain or weight loss, there's a branch of nerve called the lateral femoral cutaneous coming out from L2, L3. Sometimes they can be pinched. And then that causes a numbness on the lateral, meaning the outside of the thigh. And so that's my first hunch. I think that might be, from the upper lumbar distribution.
After you ran the battery of tests, what was your game plan for Christina?
So my game plan is to differentiate, is this a bone, muscle, tendon, ligament, nerve, or vessel? So when I did the test, that's what it shows suggestively, but however, it could be symptomatic or not symptomatic. Like, case in point, let's say you have high blood pressure. Sometimes it's not symptomatic. Sometimes symptomatic if you have high enough or long enough, dizziness. I'm just making a reference. Same with the nerve. Some patients have nerve damage, but they say I'm fine. But some patients don't have a whole lot. And what I can test for is the large alpha-1 myelinated nerve, meaning just the big nerve. Their superficial nerve on the muscle can irritate and cause the same thing. So now I have to differentiate between, is it something I test or superimposed by something else. So I think we're updating the X-ray, right, to make sure the bone and joint is where they should be. And then after that, do clinical examination like palpation, meaning I just press on the certain muscle and tendon distribution based on the myofascial pain graph to see if she will elicit a response, and she did. So that helped me to. Same thing as like different perspective from imaging, the EMG was the physiology test, and then the clinical diagnosis combining, and therefore you can, I wouldn't say be 100%, but I would say like 70 to 90%.
Well, Dr. Ngo, I know from having spoken with you in the past that physiatrists work with a lot of other disciplines. You have a lot of collaborators in trying to help patients get better and reach their goals. Can you give me some specific examples of what you've done working with Christina to help her get back to where she wants to be?
Oh, yes, definitely more. So I'm more like a functional doctor. I help patients to improve their function. A lot of time, if you imagine in severe case like brain injury, stroke, or amputation, or a patient with spinal cord injury, some of them, they just want to walk again, swallow again, talk again. You can see very basic function. And Christina, she's very high function. So the part is like, it's more like icing on the cake. What can we do to keep the pain down and increase her function? Meaning stretching, range of motion, strength, and endurance. So she want to improve on that. And then so that's why the next step is pretty straightforward. And I asked the physical therapist, we have a great physical therapy in town, so they work with her and then see if that will improve. And she did improve with them because I reviewed a physical therapy note, and she did well with them. And now even before our meeting started, she told me she can cross her leg, and she seemed pretty content and happy.
He was spot on with what was going on. Referred me to therapy where I needed to be, and now I have feeling, not all feeling, but some feeling back in my leg. And I'm balancing so much better than I have. It's just, I love it. And like he said, I can cross my legs. I haven't been able to cross my legs in a long time. To be able to sit like this it feels really good, actually.
I just want to add on top of that, you have to give the patient the credit too, because it's a push and a pull. So they are pushing up to improve their health, you're pulling. So Christina worked very hard. She followed the regimen that I prescribed for her, and I think she she told me she aimed to lose weight on top of that, right? And then on top of that, she worked extremely hard with the therapist. So those factors combined, she improved. So I wouldn't say it's all the doctor. I think it's mainly the patient. I would say 60 to 70% is her effort. And I just pretty much regurgitate science or what's in the book, for the past 12 years of schooling. So that's pretty much it.
Well, I know that you work with some patients who dive in and work hard the way Christina has. You also have some who are less enthusiastic, who don't follow instructions very well, right?
Yes, that's quite common because if you're looking for so typically I try to put myself into the patient perspective, not because I cannot sympathize, I can empathize with them. I done rehab medicine, so a lot of very, patients have major loss of function. So the reason is a lot of time patients are more resistant to the regimen is because number one is they've been going through this for a long time. They have a lot of pain. Things have tried before. On top of that, they have depression, anxiety. They feel like it's not getting better. And so you have to figure out the underlying cause for them. In Christina's case, she is pretty straightforward as far as it's more musculoskeletal and myo nerve involvement. But in some cases, so my point is, yes, so it could be a underlying cause with some psychological and mental involvement.
Yeah. Well, Christina has told us that she was dealing with some depression. She had the physical issue. She wanted to lose weight. She has. She wanted her mobility to improve. It has. The gait and foot strike are works in progress, but those are improving. And her goals include being able to go on a hike. So Dr. Ngo, can you give her your medical clearance to go on a hike?
Oh yeah, definitely. I don't see why not. I mean, I highly encourage. I'm happy because that's a positive outlook because physical therapy have shown to reduce a lot of many other conditions. I myself, I try to walk every day after a long day of work. If you walk around Wallapai campus, you see me walking around. Mm-hmm. I'm not lost. I'm just trying to get my step in. So I look like I'm lost most of the time, though.
I love that.
Christina, as you look back on this whole process, how has it been for you? What do you want to say as we sum it up?
Just thank Dr. Ngo. I told him, they said I severed a nerve, and he looked at me. I can't get over the way he looked at me. I don't think he even knows that he looked at me that way.
Yeah.
But
it just didn't sound right to him.
It didn't hit his ears right. And that actually gave me hope, though. When he looked at me like that, I was like, okay, what is going on then? And then when I found out exactly what's going on, it was like, okay, this is all totally workable. I can do this. I don't need to be in fear. I don't need to be depressed. I don't need to be any of those things. Yeah. It gave me hope. He really did. I just want to thank him for giving me hope, him and the therapy team. If it weren't for them, I would still be quite a bit heavier and a lot more miserable. Like, I understand that. I know that. I know I played a part. My willingness to do this has played a part. But it was their understanding, it was their explanations, it was them being kind to me. Like, I didn't feel like an idiot. I felt like this is just something that I'm going through and that they can help me get through. So just thank them for that.
Well, I appreciate that. And that look was intentional. No, I'm serious. Like, you have to reassure the patient because from the way she described, I know there's a lot going on in her head. When the patient see me, she's not the only one. They came in, it was either something they look up online or they heard from somebody, and it's just part of survival. We tend to think the worst of the situation, and even myself, if you go online, you dig deep enough, it'll lead to cancer and death. I'm not saying online's wrong, but that I didn't want to turn this to a comedy show, but you usually that's the case, right? So I understand that concept because she suffered from this. She is miserable from this condition she has. So my job is to reassure her. Number one is to be optimistic with the patient, reassure the patient, and build that comfort and trust. So I think that leads to a better prognosis or outcome. You cannot fix everything, but the least you can do is reassure the patient and make it feel like someone is listening to them, care for them, and want them to get better. And then if as a provider, if you can, I'm teaching the younger doctor when they see me, if you can deliver those three, then most of the time the outcome is more positive than negative.
That is Dr. Thien Ngo. He is a physiatrist at KRMC. And Christina Ingersoll, she is a patient access representative at KRMC, and she's a patient of Dr. Ngo. Thank you both for your time today, and thanks for sharing the story.
Thank you so much, TG, for having us.
Thank you.
And thank you, Christina.
Thank you, Dr. Ngo.
And that is the program. That's Focus on Your Health. Special thanks this week to Adam Barnard, Julia Walters-Kowalska, and Sean De La Riva of KRMC Public Relations. They helped to make this program possible. I'm TG Lafredo, and thank you for listening. Stay healthy, and we'll catch you next time.